Thanks for joining me. So Thomas, can you tell me a little bit about your company, Simpler? What do you do?
We do social media analytics, specifically in the healthcare space.
Can you speak a little bit about the healthcare hashtag project?
Sure, it's a database of tweets, and we follow about 4,000 or 5,000 healthcare-related hashtags on Twitter. And the database has about 550 million tweets in it right now, growing at sometimes close to 1 million a day, several hundred thousand at least.
Well, we started out by trying to make a helpful list of healthcare-related hashtags so that people, especially physicians, should adopt the use of Twitter and social media. So easier to them to sort of navigate the madness out there on Twitter. So that's how it all started. And we opened it up to public and so they can submit hashtags to us. And that just started the floodgates. And so we're here at now 4,000 or 5,000 hashtags. And now we data mine all this for research purposes. And that's what we do today. We tracked about 1,068 healthcare conferences from 2013.
Like Medicine X?
Medicine X is one of them, and from around the world. And so we looked at the data from them, that's 1.1 million tweets, and we categorized them trying to figure out who the patients are, how many patients are in each conference among the top influencers. And then we categorized all these conferences in two groups, those conferences with more patient participation and those with less patients. And we did this in order to try to figure out if those conferences that are more patient inclusive, if they are performing better on certain metrics. And the research we found is that yes, they indeed do.
And when we're talking about an impact of a conference, is more always better? In other words, is having more tweets mean that you have more impact in the social media sphere, or is there a way to measure how viewed these things are, what kind of impact they're actually having?
Right. Yeah, that's a great question, and we see both things. You know, can have an amazing amount of tweet volume, but it might not be very impactful. Then you have conferences who have great volume, and what we look at actually is what happened after the conference, the 30 days after the conference is over. So for most conferences, the tweet volume just dropped right down and it's dead. You know, there's a few, goodbye tweets and nothing more happened. But the truly impactful conferences, like Medicine X, they sustain the whole community, and you can see they keep talking and sharing the same thoughts being shared at the conference, and they discuss the same things. So that's how we actually measure that.